Welcome to this week's episode of UT Southwestern's What to Know. Our experts tell us we're facing not one, but two public health crises right now. COVID-19 and the effect that COVID-19 is having on our mental health. Text and calls to helplines for people in emotional distress are soaring, in some cases as much as 1,000% when you compare to this time last year. Joining us today to talk about improving our own mental health during the COVID pandemic are two members of the UT Southwestern Department of Psychiatry faculty. Dr. Madhukar Trivedi directs our Center for Depression Research and Clinical Care at UT Southwestern, and Dr. Nicholas Westers, a clinical psychologist at UT Southwestern in Children's Health who specializes in children's mental health. So thank you both for joining us. Dr. Trivedi, we're hearing that during the pandemic, we're seeing more people with symptoms of anxiety and depression than we've seen before. Can you tell us a little bit about what you're seeing in your practice?
So there are two groups of people for which the concerns are beginning to be seen very rapidly, and that is those people who have had history of depression and anxiety in the past are beginning to have recurrences. They're having significant problems. And the second group, which is even more concerning, is those people who used to have some difficulty but didn't get diagnosis or treatment because they had connection, they had social connectedness, they had social support structures that are beginning to shrink. And both of those groups are having symptoms and are coming in for help more than they did before. The third group of people for which we should be really vigilant about are people who have had some interpersonal difficulties and leading to higher rates of domestic violence. And those people who were using some alcohol but maybe overusing. And those two groups are also needing more assistance and support and probably treatments as we go forward with the pandemic.
And Dr. Westers, I assume you're seeing something similar, increased rates of mental disturbance, mental health issues in children and young adults. Tell us a little bit about what you're seeing in your practice and things we should be looking for.
Yeah, similar to what Dr. Trivedi had mentioned, there is some research already coming out of China where children and adolescents are experiencing more symptoms of anxiety and depression than they were prior to the pandemic, particularly where I am at Children's, seeing that more in those who have already experienced symptoms of anxiety and depression and worsening. And one of the things that I'm seeing a lot of as far as expressing concern, not so much related to those very symptoms, but being more concerned about boredom and social life. For adolescents in particular, and older children, wondering, are my friendships still going to be the same? Is so-and-so still going to want to be my friend? And will it be awkward when I see them? And is there going to be school in the fall? Am I going to be able to see my teachers, my friends? And so I think those are some of the worries that a lot of young people are having now. And then the boredom, being stuck at home and not knowing what to do. And I think parents are also feeling the brunt of that.
We're all having some symptoms like that, right? So we're all bored. We're not having as much social contact as we're used to having. So how do we know what's normal and what's a warning sign?
I think the way to think about it is having some anxiety around it seems to be sort of quite understandable. All of us, or a lot of us, have that. I think when it crosses into where it affects your normal day-to-day life in terms of sleep, in terms of appetite, in terms of your willingness to do things that you would think are not difficult to do, like calling your family, or if somebody from your family is trying to call you and you're not interested, don't feel like it, when these additional symptoms are really affected. And in addition, if your circadian rhythm in any manner is beginning to be affected, then we should be really vigilant, because that may be a sign that it's moved beyond anxiety about the current environment to that next level.
And Dr. Trivedi, if we see those kind of symptoms, those kind of signs, what's the first step we should do?
If you have had recent contact with the primary care provider, then that is probably where you start first. Connect with them increasingly as the health systems are adjusting to this. Most health systems are available to communicate via electronic means and start your process. Secondly, there are a lot of hotlines and call lines available in most areas. In our area, Dallas-Fort Worth area, there are several of these call lines available where you can call in somebody can talk to you briefly and triage to say, maybe you should go to a behavioral health provider, maybe a primary care provider, etc. Do not ignore it, and not when somebody gets to that point where they think there is a need, in general, there is a need.
And Dr. Westers, what are the signs we should be looking for in our children and our children's friends to know that we need to seek more professional help or some additional resources or guidance?
Well, most parents know their children better than anyone, and so they can really pick up on the nuances that maybe others are not able to. And so, if your child, for instance, is really social, and obviously we're participating in social physical distancing from individuals during this time, but we're connecting virtually now. Now, if their child or if your child is suddenly not even connecting virtually, not communicating with friends, which is really abnormal for your child who's so social and really thrives off those connections, that might be a concern, that withdrawal. Second, when we think about sleep, disturbances in sleep can be an indicator of depression or anxiety or a normal reaction to the stressfulness that's going on in our world right now. So what I have seen is many children and adolescents kind of shifting their sleep a little bit back to they're going to bed later. Now that it's summer, they're getting up later. However, if what's happening in your child is not sleeping at all or staying up much later because of anxiety or not even connecting with friends, then that might be an indicator that it's more than just general stress.
We have to make sure that social distancing, it does not lead to social disconnectedness. The good news about the current climate is that the electronic means of communication are opening up. I can't tell you, I have 10 different ways to do Zoom and I do Google Hangouts, etc. There are ways people should be encouraged to connect with family and friends on a very regular basis. Develop a schedule, a calendar that today you will call your grandmother or mother, etc. And the second, as Dr. West has mentioned, while physical activity is reducing, we have an advantage in Texas. There are places you can go to on your own without touching people and still have your physical activity engaged. So keeping a good sleep-wake cycle and getting your exercise in and remaining connected with people in your life and family are at least things that we should encourage people to do, especially if there is any risk that they have depression, anxiety. That is something that I really strongly encourage.
And Dr. Westers, to follow on that, what are other things that we can do to replace the social interactions that our children are usually having now that they have this void? So what other behaviors, activities would you recommend?
My hope is that there's still social connectedness. So in psychology, we talk about the nuance of language. I wish that we had called it physical distancing at the beginning as opposed to social distancing, because that social connectedness is so important. And so I think parents can help their children connect virtually to grandma and grandpa, virtually to their friends, even to their teachers, and being able to maintain those connections, or do the drive-by waves, the drive-by visits, especially for birthday parties or special events. And then allowing our children to be bored is important, but we still want to be able to provide some structure. And so, like Dr. Trivedi had mentioned, maintaining routines is really important, especially for young children. Being able to know what to expect day to day when this world is throwing all these random things that we can't predict. At least we can have our children be able to predict when bedtime is, as well as when breakfast, lunch, and dinner are, and playtime. And so one recommendation I've been making with families to increase that creativity for that boredom is to create a list of things that, one, need to be done in a given day that they would like to accomplish, and two, things that are enjoyable, and then put those in a hat. And if there's just not enough time during the day to do them all, when your child is bored and is not having a connection with someone socially, whether virtually or going out for a drive-by or a visit at the park, is to draw out one of those activities and make it enjoyable and creative in that way for their families.
And Dr. Trivedi, are you worried about the long-term effects of lack of social contact for people, and what that might mean for longitudinally seeing an increase or a decline in mental health?
In the long run, I'm hopeful that we will all as a society begin to learn to get to a new normal that allows us to develop our tools to not really get permanently scarred. But I think this duration during which we have to learn that is the high risk period. In the long run, our culture, our society will figure out tools that will give us a new way of communicating that will protect us from the future.
And Dr. Western said, tell us what you think we should be thinking about long-term for our kids.
My hope is for prevention rather than having to, down the road, try to intervene at that point. And so for parents, I think it's helpful to know that the majority of parents are stressed. In fact, parents are more stressed than non-parents at this point. And we all feel stressed to an extent. And the American Psychological Association has done a couple of surveys called Stress in America and found while 82% or 4 out of 5 parents have really enjoyed the extra time with their child, 71% are actually worried about their social development. And then a little more than half have noticed some change in acting out behaviors since the pandemic began. And so I think one of the important things for parents to know is that you're not alone. And one of the things our children are learning at this time is how you're responding to that stress. And I think modeling well and taking care of ourselves well as adults, caregivers, parents is going to go a long way for our children in the future. So as humans, we're resilient. We are resilient individuals, resilient beings. And similar to Dr. Trivedi, I'm pretty optimistic about our ability as humans to really adapt and cope and do well over time.
And what advice do you have for children who are spending a little more time with their parents than perhaps they plan to this summer?
This is the time we're making memories with families. 10 years from now, 20 years from now, our children, our adolescents are going to look back, and it's really going to be the emotional experiences that they have and during this time that they're going to remember, probably more than the specific events themselves. And so hopefully we're creating memories, and my hope is that children are going to be forgiving and toward their parents, as well as parents being forgiving toward your children, that we can all extend ourselves more patience and kindness, as well as extend that same patience and kindness to others.
What resources should people be looking for to turn to as they learn about their own mental health and think about improving their own health and that of their family?
I recommend sticking with the CDC guidelines. They have resources for parents and how to talk to children about this and can connect to other resources.
In addition, I think places like our UT Southwestern and our center have resources on what people can do, especially for those who are having symptoms and having issues, should try to find at least their primary care providers, call their insurance, call the hotlines so that you can connect with somebody if there is any chance that you need treatment at that.
In North Texas, we're now seeing a second wave or an extension of the first wave of COVID cases. What advice do you have for parents and for people in terms of talking about what that means for all of us and things we should be paying attention to in preserving and improving our own mental health?
I think the second wave is really beginning to remind us that this is something that we as health and public health are still trying to understand, and it's going to take a little time. But in the past, we have handled other things, and this will have its solution. Until then, we listen to the kinds of things that you're mentioning, CDC. UT Southwestern website has a lot of guidance and information about how to handle it, so that you stay with the current knowledge we have and use that to protect yourself is the best solution.
So Dr. Westers, many of our kids were looking forward to camps or to some sort of school activity during the summer, or even just the school year starting in the fall. Now with many of those things being canceled and still with some uncertainties around school, what are you advising kids and parents, and how are you advising kids and parents as they think about those activities and the upcoming school year?
Well, I advise parents to really validate the loss that these experiences may be for their children, rather than say, oh, there's always next year. That's true, but probably not as helpful as empathizing and validating. I'm sorry that we can't do camp this year. It sounds like you're really sad and upset, and that makes sense. And so just simply validating that for children can really decrease the intensity of the sadness, of anxiety, and of stress. And so I advise parents to validate those concerns for their children. And then two, when it comes to the uncertainties about the future related to school, is it going to be in person? Is it going to be online? Is it going to be half in person, half online? If we don't know that, then we probably can refrain from telling our children the constant changes related to that conversation. And so oftentimes we as parents and caregivers and adults want to be as honest as we can with our children, and because we want them to trust us, of course, but sometimes oversharing information can be more stressful than simply not sharing information at all. So finding that balance where you can recognize that we're not sure the plan for school yet, but we will be sure to let you know when we find out. And if you'd like to be part of this conversation, you can ask again. It's perfectly okay, but we will make sure we share the most important information with you.
And what about getting out and about, Dr. Trivedi? What are you and your family doing in terms of how much activity, how much, what you're doing out and about around town?
So like I mentioned earlier, with Texas, I think we have enough space so that getting out and about in terms of physical activity or just going out is really easy in our settings. In terms of going to grocery stores, etc., we are being much more restrictive and trying to be very careful. Unless needed or essential, we are trying to still maintain safe distances.
What about you, Dr. Westers? How are you keeping you and your family safe?
Yeah, I try to practice what I preach. And so I have my mask here that I wear anytime I actually leave my office or go out and leave the home. And what's a little bit different about my case is that my wife is pregnant. And so I'm taking extra precautions and participating in social distancing, even when there were decreases in the requirements of the state. So now that we're opening up, or had opened up for a little bit, I was still participating in social distancing, making sure I'm washing my hands. And if we go on grocery runs, either I'm going alone or my wife and I are going and tag teaming it, so that way she can get out of the house while she's working from home and I'm able to come into work. And I'm also trying to make sure I sleep well, that I exercise, just as all the recommendations that I've made, washing my hands. And when I get home from work, especially if I do see someone face to face here at the office, whether for a meeting, which is very rare, or patient care with a family, I will likely change at the door and make sure I shower or wash up really well before I interact with my wife, so I can take those precautions very seriously.
Well, thank you both for joining us and for this additional advice that we all needed around our own mental health. So again, thanks for all the good expertise, and again, best to both of you, and thanks again.
Thank you very much.
Thank you again for joining us. As you heard today, staying mentally healthy is staying healthy. Things like eating right, exercising, getting enough sleep, and most importantly, asking for help when you need it. We hope you'll join us again next week, and until then, stay safe and stay healthy.